Hi, I'm Howard Dobson. I have lived in the Fergus-Laura area for almost 30 years. I am a veterinary radiologist by training, and for many years I worked at the University of Guelph in the vet school. I'm chair of the board of the Groves Memorial Community Hospital, and I'm here today to tell you about what's happening with the new hospital build and other things that have been going on in the hospital during the past year. Building a new hospital is an extremely lengthy, detailed and complex task. I'm happy to report we have achieved a great deal this past year in coming closer to realising a new hospital. Roadwork and site servicing for the new hospital site began last June. Before any construction can begin on the hospital, we need to create the roads, electrical, street lighting, among many other things. Groves Hospital staff and volunteers have been hard at work with consultants and the Ministry of Health and Long-Term Care to move to stage 3 of the 5-stage capital building process. This means we were able to move to selecting a planning design compliance firm, also known as PDC. The hospital has completed a master plan and functional program. The PDC team will use this master plan and functional program to prepare technical documents that will establish guidelines and performance requirements that the successful building team must meet when preparing its designs. We hope to announce the PDC team in the next month. Some of the highlights of the new hospital are: we hope to build on an existing model of care that integrates traditional hospital-based acute care services with community-based services, provide a framework to address future flexibility and changes in technology, provide facilities that enhance our infection prevention and control standards and reflect best practice and evidence-based design, provide services within a model of care to accommodate demographic changes in the future, and the PDC team will use the master plan and functional program documents prepared by the hospital and approved by the Ministry of Health and Long-Term Care to prepare technical documents that will establish the guidelines and performance requirements that the successful building team must meet when preparing its decisions. There seems to have been a lot of construction going on at the current hospital. Why are we investing in the old hospital when we have a new hospital on the way? The new hospital is planned to be completed in 2019. In the meantime, we still have to operate a hospital providing the same high-quality services patients have come to expect. There are certain features of the current Groves Hospital that do not meet provincial safety standards. A good example of this is that we recently had to upgrade the hospital's admitting and emergency washrooms to ensure provincial accessibility standards are met. We also increased the number of fire pull stations to meet fire code requirements. Many of these construction projects were completed using health infrastructure renewal funding, which cannot be used for other purposes that we receive from the province. Ebola has been big in the news this past year. How did Ebola affect the Groves Hospital? The Ebola outbreak in West Africa sent all healthcare facilities worldwide into review and change in their infection control procedures for potential Ebola patients. Groves Hospital was no exception to this. Staff spent countless hours reviewing Ministry of Health mandated infection control directives, updating policies and procedures, and becoming educated on the latest changes, specifically on how to put on and take off personal protective equipment. All of the Groves staff and physicians should be commended on their ability to quickly adapt to new procedures in this ever-changing healthcare environment. So in the past budget, as you know, hospitals did not receive any increasing funding over the next year, so that poses the question, how will Groves Hospital manage? We were not surprised by this announcement. Groves Hospital has already been working on ways to become more efficient and reducing costs. One of the initiatives is through a program called Lean. All staff have been or will be trained through on a Lean program which looks at processes, breaks it into parts and eliminates waste. By doing this, we are improving patient care, reducing costs and building resiliency for the future. Groves Hospital was evaluated in the fall by Accreditation Canada. Now, what does this mean? Accreditation Canada helps us to ensure all Canadians have the right to safe, high-quality health services. Through standards and accreditation programs, Accreditation Canada works with healthcare organizations to help them improve quality, safety, and efficiency so that they can offer the best possible care and service. External surveyors spent 4.5 days assessing Groves Hospital's clinical programs, services, leadership and governance against Accreditation Canada requirements for quality and safety. We were very pleased to announce that we were awarded Accreditation with Commendation. This award is only awarded to organisations that go beyond the requirements of Accreditation Canada and are commended for their commitment to quality improvement. It is satisfying to have external reviewers recognise the accomplishments and the commitment by the Groves Hospital staff, physicians and the board. What other types of quality improvement programs is the hospital working on? Groves Hospital was recently selected to participate in the National Surgical Quality Improvement Programme Ontario. This is an internationally recognised programme to measure and improve quality of surgical care. The programme will run for 30 months with additional funding from the Ministry. Groves Hospital Dr. Tina Williams is our surgeon champion. How do you include the patient and their family in the services you provide? Groves Hospital staff, physicians and board care what patients think and want to improve the patient experience at the hospital. For care to be truly patient-centred, patients, families, caregivers and communities need the opportunity to provide meaningful input into the way services are delivered. Starting in April, the Groves Hospital patient care managers began visiting patients with a formalised questionnaire. This new initiative ensures hospital staff are listening to all patients' voices and solves problems as they occur. In October 2015, the hospital will hold several community advisory forums to chat with community members about activities at the hospital and seek their feedback. Groves Hospital has a reputation providing high-quality care. What factors contribute to this success? Groves Hospital operates a unique model of care compared to neighbouring urban hospitals. The family physicians providing primary care in our community also provide our hospital's emergency, obstetrical, surgical and inpatient care. The same family physicians also provide non-urgent care in the communities after our clinics and in long-term home care. Our physicians are able to follow their patients every step of the way, achieving a seamless continuum of care. A recent hospital staff satisfaction survey shows our Groves employees are very happy to work at the hospital. Staff participates in wellness programs and is offered skills days to keep their education up to date. Our staff's collective energy, wisdom and commitment provide excellence in the quality of care patients and families receive. We are also fortunate to have the support of our staff, volunteers, community, foundation and a governing board with a clear vision and commitment to quality services. Our key to our future success is the partnerships we have developed with agencies such as emergency medical services, community care access centres, mental health and the Upper Grand family team. It is the combination of all of these contributors and more that enables Groves Hospital to be a leader in the provision of excellent, compassionate rural healthcare. Are there any new programs or services at Groves Hospital? As part of a provincially funded initiative, Groves Hospital was able to enhance their physiotherapy and speech-language services, which allowed a greater volume of patients to be seen and supported. We have also been able to reduce our physician wait list with the welcome addition of 3 new family physicians in Elora, Drs. Liu, Carlson and Hodkinson. Our diagnostic imaging department introduced a new virtual colonoscopy service. This is a new type of X-ray exam that applies the well-known CT technique to examining the interior of the colon or large intestine without having to insert a viewing instrument. The hospital's diagnostic imaging department also purchased a new digital mammography machine. This new machine, once installed and staff trained, will provide instant images and allow patients to spend less time waiting in an uncomfortable position. Thanks to a generous donation of iPads from Dr. Enver, the hospital launched a new virtual visit program. With the help of a volunteer, our elderly patients are able to use Skype or FaceTime to connect with family or friends that cannot otherwise come to the hospital. The best way for the community to keep up to date with hospital happenings is to look at our website, gmch.ca, for the most up-to-date building planning work and information on news, programs and services.